Today, we are going to cover three different questions that I have come across on many different client calls. So I thought it'd be pretty smart to make a video out of them. These are going to be the three that we're going over today. Feel free to use the description below to jump to those questions, get what you need out of this video, and get on with life. All right, so let's jump right into it. Question number one is, don't you think Medicare will eventually be privatized completely? Yes. I mean, that's not my answer to the question, but yeah, this is a hot topic. Obviously, we're in 2025 and, it's August and there's a lot going on with the current administration. This is such a highly political, Medicare is just something, unfortunately, that gets thrown around no matter which administration is in there. So my answer to this is just some parts of Medicare are already privatized through Medicare Advantage and Medicare prescription drug plans. So two things, the Advantage, also known as Part C, and then the prescription drug plan. So if you notice, those are parts. So if you ever want to look and see what the changes of Medicare are going to happen, you mainly want to look at the parts, because those are going to be the ones that are privatized and also the government has control over them. So Part A, B, C, and D. Full privatization, though, is unlikely, mainly because, like I said, it's got a lot of political oomph in it, and major changes would just throw the whole ecosystem out of whack. So if you're sitting there saying, is Medicare going to be around? Should I take it? It's not going to affect you, okay? If it goes anywhere, it's more than likely going to affect someone a little bit younger. So I'll just leave it at that. Let's move on to the next question. Do I have to answer health questions when switching from one supplemental / Medigap plan to another? So for this question, it's talking about Medicare supplements and Medigap plans. So those are going to be the most common ones are going to be the G, they're going to be the N. So my answer to this is, unless you're within your Medigap open enrollment period, which is 6 months from the Part B start date, no matter if you're aging into Medicare or if you're now retiring and you're about to start your Medicare, you're 67, 68, 69, 70, whatever it is, and you're outside of your turning 65 enrollment period, you'll look at your card and count 6 months from that date. Within that 6 month period, a Medigap company, also known as Medicare Supplement Company, doesn't matter if it's United Healthcare, Mutual of Omaha, Cigna, Aetna, Humana, they will not ask you medical questions. Therefore, it's an open door into the policy, no questions asked. Okay, either that period or you have a guaranteed issue right, aka almost like a life event. You guys have experienced this through your group insurance, the life events. When those happen, then you're able to make changes outside of the enrollment period, same thing. So if you're losing employer coverage, meaning you got fired, okay, loss of coverage, Medicare Advantage plan is canceled in your area. That happened a lot going into 2025. Plans just straight up discontinued. I can probably tell you that's going to happen a lot going into 2026. So keep an eye out on that. It means you have a guaranteed issue right, no questions asked, into a Medicare supplement, okay? And then the insurance company can require, outside of those two periods, so open enrollment and guaranteed issue, the insurance company can require health questions and may deny coverage or change or charge more based on your health. So outside of those two scenarios, So meaning if here's a very common one. Alyssa, I'm going to start with a Medicare Advantage plan. I'm healthy. There's, why spend so much money? I can get into the more robust plan later on, when things start to happen. Wrong. Okay. More than likely, when one wants to get into a Medicare supplement plan, after starting a Medicare Advantage plan, it's because the wheels fell off. Health declined. Okay, and now you're like, shoot, maybe I should go with a more robust plan that I'm happy to pay for to get a little bit more coverage and a little bit more freedom, less prior authorizations, no networks. Yeah, sign me up. Well, you no longer qualify anymore. So plainly put, if you cannot pick between a Medicare Advantage plan and a Medicare supplement plan, you're just on the fence about both, you don't know which way to go, you may not always you'll have the opportunity to get into a Medicare supplement plan later. You may not always have the health to be approved for it. Plainly put there. Next question. Am I eligible for a special enrollment period if I lose my employer coverage? Answer is yes. You will have losing employer coverage. I'll just read straight from the slide. Losing employer or union coverage qualifies you for a special enrollment period. You generally have 8 months, not generally, you have 8 months. I don't know why I stuck generally in there. You have 8 months to enroll in Medicare Part B in 63 days. This is the one that people always lose because I don't know why. I think because the penalty is higher on Part B. The penalty, there's 2 penalties you can get. B as in boy and D as in dog penalties. Okay. You have 63 days to enroll in creditable coverage in a Part D Medicare Advantage plan when you come off of creditable coverage. Okay, so creditable coverage being your employer coverage, meaning your employer, it has 20 or more employees, which is considered creditable coverage. You lost that. You have 63 days to join Part D as in dog. So this goes back to when you initially turn 65. Let me tell you how this scenario is easily achieved when you turn 65. Technically, you can delay Medicare if you have creditable coverage. Number one, you can delay Medicare by doing nothing, or number two, enrolling in Part A. It's okay to do either one of those. Please don't comment in the comments and say you have to enroll in Part A at least. That's not true. Go to Medicare.gov. You can do it in 2 ways. Number one, do nothing. Number two, enroll in Part A. By enrolling in Part A, it makes this situation easier to maneuver. Because in this particular situation, let's imagine you are 68. You're retiring, you're losing your employer coverage. So the clock starts. 8 months to get Part B, 63 days to get Part D, a prescription drug plan. You can have prescription drug coverage with only having Part A. So someone like myself, a broker, maybe the broker that you're working with, you can go on Medicare.gov and do it yourself. The only prerequisite for having a prescription drug plan is Part A. While you start to work on your Part B, you can get your drug coverage said and done, boom, cross off that Part D penalty. Now all you have to worry about is getting your Part B application done, CMS 40B. You got to get employer verification done to say, yes, I had employer coverage since I turned 65, at least since I turned 65. That's CMS form L564. So you'll be working on that. You got 8 months to do it. It's okay. But you already got your drug coverage squared away. So that is how you do it. So again, going back, your special enrollment period, you have and that was called an SEP. Okay, you've got your first turning 65 initial enrollment period. You pass that up because you continue to work and to have group coverage. And then you're going, boom, either you're retired or got fired. Now you enter into a new special enrollment period into Medicare. It's okay to come from creditable coverage and join Medicare. 8 months for Part B, 63 days for a prescription drug plan. And that's the end of the questions. So stay tuned for the next video. I'm happy to do these. I think I'm going to do it more in this way. Number one, keeps me off my soapbox. I love to get on a good soapbox just because I'm a darn nerd when it comes to Medicare. But number two, these are the most common questions I get on my calls every single day. So I hope you got a lot out of it. See you next time.